This conference will now be recorded.
Good afternoon, everyone. This is Melissa Morin. I'm a Public Information Officer with the Whatcom County Health Department. Welcome to our media briefing for January 27th, 2021. Today we're going to hear from Erica Lautenbach, Whatcom County Health Department Director, and from Amy Hockenberry, our Vaccine Planning Lead. Oh, I'm glad I'm not the only one with an animal in the background. You may hear a dog in my background. We will be recording this, as you heard, and it will be available in just a couple of hours up on the Whatcom County Government's YouTube channel and on our media page at whatcomcounty.us/COVID. And as a reminder, please do go ahead and mute yourself as you join. And we've got just a few short remarks from Erica and Amy today, and then we'll quickly move into question and answer period. So at that time, we will invite members of the media to type your name into the chat, and I will call on folks in the order that they appear. And with that, I am going to turn it over to Erica.
Thanks, Melissa. Thanks for getting us started. Apologies, I just got back from a run, so this is life, and when I can find a few minutes to fit in some exercise and some sanity, I'll do that. So hopefully none of you will use this in video footage. I would ask that in advance. I just want to share briefly that we are cautiously optimistic. In the last week, we've seen our rates start to come down a bit. We're very grateful to the community for really taking our warnings and our urgent asks seriously, and we're starting to see the results of that. We also are seeing some slight decreases in the demand for testing, and our percent positivity was slightly lower in the last week than it was the week previous. So this is all good news and good indications. It is too soon to tell if this is a true trend or a blip, but we are cautiously optimistic as we're starting to see these case rates come down. So I'm going to turn it over to Amy Hockenberry, who is our leader of our vaccine team, to provide some brief updates as well.
Thanks, Erica. Well, I might be speaking for a team. There is quite the team and a lot of great effort going on. So I just want to provide an update on where we're at. So as we're all hearing, there is still a considerable gap in between supply and demand for vaccines. Allocations into the county are fluctuating from week to week, so this makes planning quite difficult for everyone. However, this week there is 1,700 more doses being allocated to Whatcom County. So this brings us up to approximately 13,800 first doses that have been delivered to the county. And then as of January 23rd, there have been a total of 11,796 doses given in Whatcom County, and this does include both first and second doses. So we estimate about 59,000 residents that are currently eligible in both Phase 1A and Phase B Tier 1. So if we're looking at 13,800 first doses for about 59,000 people, that's roughly about 23% of that population getting one dose. So it gives you a sense of context of where we're at. So we're expecting to be in the current phase 1A and 1B1 until at least March, and that's what we're projecting for right now. As allocations coming into the county are fluctuating from week to week, they are also fluctuating coming into the state. And then I believe we mentioned this last week, but the governor did announce that there will be new mass vaccination clinics or sites elsewhere in the state. And so we do expect this to impact Whatcom County's allocations in the coming weeks. And then, however, with the new urgency of the Biden administration to increase supply, we're hopeful that vaccine distribution will increase here in the next couple of weeks or in the next month. So that's hopeful and on the horizon. As for an update on our current planning efforts, the health department continues to convene enrolled providers, and we're working to assess their capacity and their ability to vaccinate beyond their staff and their patient panels. So we're hosting weekly meetings with these enrolled providers. We're helping to problem solve, work on solutions to address current challenges and barriers, build collaboration, and also to identify where the gaps are and then to work on filling those gaps. Just as an example, we're working with community partners right now and some of our vaccine providers to create access points for caregivers who are independent providers. This particular population comes with its unique complexity and challenges. We continue to provide assistance and communications with the State Department of Health, and we're also ongoing connecting employers with eligible employees with vaccine administrators. I do want to note this is pretty time-consuming work, so it's really important and helpful to have our medical providers and our pharmacy providers focusing on vaccine administration while the health department is working alongside them to improve systems and remove barriers. So we're seeing that our providers, the current enrolled ones, they're dedicated, they're working extremely hard, and we're just really grateful for their partnerships. And as for other planning efforts, you may know our newest efforts have been focused in on large-scale vaccination planning. So we're working with Peace Health, CMAR, Unity Care Northwest, and Family Care Network to develop and prepare large-scale vaccination clinics once there's enough supply coming into the county. So this work is being led by a steering committee with representatives from each of those providers, along with Whatcom Unified Command and the Health Department. And again, we're just really appreciative to their commitment of these larger medical providers to be working collaboratively to prepare for these clinics. And we'll continue to provide updates as more planning unfolds in the coming weeks. And just as to end, as a reminder, again, people can go to www.covidvaccinewa.org to find out if they're eligible in the current vaccine phase and to see which of the providers in Whatcom County are enrolled and offering vaccines. Please note that, the vaccine supply is very limited in our county, so those providers listed may not have vaccines, or they might be fully booked and scheduled out for the ones that they do have. Again, if a person's regular healthcare provider isn't listed on that list from that website, they can check their provider's website for more information. And we also encourage people to check their emails, see if they have texts or even portal messages from their providers. And so we're still encouraging and asking people not to call providers directly. They're receiving so many calls that their phone systems are overwhelmed, and people who are trying to reach their providers for other health concerns have not been able to get through. And lastly, we just thank everyone for being patient in these times, and hopefully the supply, we know the supply will be increasing here soon, and these times of lack of supply will be over, and we'll have plenty moving forward. So I'll end there, and I think we'll take on questions from this point.
Yeah, thanks, Amy. So again, if you would like to ask a question, members of the media, we invite you to type your name into the chat, and I will call on folks in the order that they present. All right, our first question is from Joe Tehan with KGMI. Joe, go ahead. Joe, I do see that your microphone says that it is on, but we cannot hear you. Do you want to give it another try? Looks like we're still having some audio challenges. Joe, if you want to go ahead and type your question into the chat, I can read that out while we look at fixing your audio. In the meantime, I will move on to Key Relia with the Bellingham Herald. Key, go ahead.
Yes, can you hear me?
We can.
Great. Amy, can you repeat the numbers again for two things? One, the estimated number of people who are in Whatcom County who are in phase 1A and then phase 1B1. And then also the estimation of how many people in that population you think have either been vaccinated or received their first dose. I think it was 23%, but I want to double check the numbers. Thank you.
Yep. So the estimated number that we have for phase 1A and phase 1B tier 1 is roughly 59,000. I do want to caveat though, estimations of people over 50 years old in multi-generational households is a difficult number to come by, to really get close to, so that it is an estimation there. And the number that I had offered was based on the total number of vaccines that have been, first doses that have been allocated, not necessarily given at this point. So it was 23%, but it was based on that 13,800. When we look at total number given, which was the 11,000 number, that includes both doses. So I'd have to run different numbers for you, and maybe I can get that to you afterwards, but it gets a little more complicated given that that number includes both doses.
Great, thanks, Amy. I'm gonna jump down to Joe's question here. Joe Tehan is asking, any idea when mass vaccination clinics will be available here in Whatcom County?
Yep, the first thing I'd have to say, that's gonna depend on supply. So while we're putting all of our plans in place and getting ready, even if we have all our plans in place and a location all set up, that will still be dependent on the supply coming in. But we're definitely looking at having plans in place in the next couple of weeks and be running by the end of February, early March. It could be sooner. And then again, based on supply, it could be later.
If I can add to this, Amy, and please correct me if I'm wrong, you know, mass vaccination is one strategy, and it's particularly effective in areas where there aren't a number of providers that are enrolled, where there may only be a few. And so, for example, in other counties, you may see that there's a centralized site, and that is generally that's generally available and great if there aren't very many providers. We have 26 enrolled providers in Whatcom County, and this is the part where I want you to correct me if I'm wrong, Amy, but I believe that at this point, so we're receiving 1,700 doses this week, but our providers have indicated to us, given all the number and what their capability is, even before we set up something that's more a mass vaccination, that they could vaccinate 8,000 people this week if we had 8,000 doses. So the capacity to do more right now, right out of the gate, far exceeds the supply we have. So that there is a tool that could be a centralized place, that could be a partnership, but there's also there are so many providers that have more capacity than supply that we could ramp up very quickly, even without a mass vaccination site.
Our next question is from David Rosbach with the Bellingham Herald. David, go ahead.
Hi, Erica. Thank you for taking the time to talk to us. I was wondering if you could talk a little bit about the outbreak at the Whatcom Jail's Work Center. First of all, how fortunate are we that we're 10 months in before we've had an outbreak in a setting like this, and also what steps are being taken to try and contain it?
Yeah, yes, I echo that that we know so much more a year into this than we did during some of our first really challenging outbreaks in our long-term care facilities. So we have good systems in place. We have good collaborative relationships with the sheriff's office and their staff, and we're working very closely with them to do testing twice a week, to, when necessary, transfer individuals to our isolation and quarantine facility, which is a well-oiled machine at this point as well, and to provide some technical assistance on how to, what we call cohort groups. So not having people who tested positive in cells with people who are negative, who've tested negative, and just making sure that we're isolating folks as much as we possibly can. These situations are always very challenging given the space constraints and the need for security and other measures. So, but we are working very closely with the sheriff's office and the corrections division within that.
Thanks, Erica. And I will say we do have an update to share on that either later today or first thing tomorrow morning as well. Our next question is from Robert Mittendorf with the Bellingham Herald. Robert, go ahead.
Hi, Melissa. Thank you. With the limits on available vaccines, are you worried that people whose second dose is coming up might not be available to get it? Or are those people being prioritized when vaccines come in?
Just trying to figure out how to start answering that question. So the way that the allocations are happening is that the second dose is based on first dose allocation. And so while the week-to-week allocations are fluctuating, providers are receiving the second booster dose for that first group of doses that they got usually 3 to 4 weeks later. So it is already allocated and a different, it's not even in an ordering system, it's just in a distribution mechanism. So those are already allocated to those individuals who have received their first dose. And providers are notified and aware of this.
Great, thank you very much.
Next question is from Key Relia with the Herald. Key, go ahead.
Yes, Erica, thank you for the context regarding what the providers here could do if they had adequate vaccine supply. I wanted to make sure I understood what Amy had said about the mass vaccination sites. The one that you're talking about would be organized locally by and working with the local providers. This is not the state-run mass vaccination sites. Is that correct?
That's correct. There are no current plans for a state-run vaccination site.
Thanks, Erica. Our next question is from Vanessa with King 5. Vanessa, go ahead.
Hey, thanks for taking my question. How much influence does the state have on, this is for counties, but specifically here for all counties, but specifically here for Whatcom County, how much input does the state have on your plan of the general rollout of vaccines? And do you think the state is doing enough or not doing enough in terms of giving directions on how to do this?
Erica, did you want to?
You can start with the first and I can talk more broadly if that works, Amy.
Yeah. As far as their influence, I think your question was influence or direction over our local planning. The state has set up the vaccine provider enrollment program, which really is the infrastructure for this rollout right now. Individuals, entities that are eligible to enroll are enrolling through that state program, and it's through that program which distribution is occurring. So what I believe you're asking about is if they're weighing in on our collaborative approach or the ways in which local design is happening and not so much, but we are at the constraints per se of the state design in general. I think that's where if I'm not answering your question, please let me know. I guess I'll reiterate, as far as local collaborative efforts, that is definitely, we're soliciting input and we're asking technical questions of the Department of Health, and they are supporting us in that way. But they're not, on the ground working with us on building collaborative local design. Let me know if I don't hit that question right.
Yeah, there's a fair amount of discretion by county on how they work with partners and how they ensure that vaccine is administered. The state has created the container by which we do all of this. Amy described the enrolled providers, but also there are statewide systems like the Phase Finder and vaccine locations whereby the state is providing us with some technology assistance and other data assistance. So that kind of equalizes the playing field for large and small counties alike.
Oh, can I just ask a follow-up?
Yeah, please go ahead.
Cool, thank you. Yeah, and for my second question, do you feel as though the state is doing enough to help you guys out and to facilitate, or do you wish that maybe they had a stronger influence in some of these plans as you are rolling out and these vaccines and maybe coming up on some obstacles? Do you wish the state had more influence? Should they be doing enough to help you guys out?
I guess I would answer, I have an incredible amount of confidence in our team, in our local providers, and in our partnerships. And we're working really well together. And it's nice to have the local control in terms of designing a system that works for Whatcom County, both for our population and for our provider mix and those that are enrolled. There is no one size fits all, and I'm grateful, frankly, that the state has allowed us the leverage to be able to do this in a way that works for us. So I think from my perspective, we appreciate that. Of course, we would like more vaccine, and the state would love to have more vaccine from the feds. And I think that's our biggest request of the state is, again, some of those technical and technology assistance, and then just more supply.
Thank you so much.
Next question is from David with the Herald. David, go ahead.
Hi, Erica. You mentioned some encouraging news coming from the news, or excuse me, from the numbers. I assume nobody's more happy to see that than your contact tracing team. Can you talk a little bit about how well were they able to keep up when we were seeing triple-digit caseloads on certain days? And a second part to that question, you've said earlier that about 80% of what you were able to trace was back to small social gatherings and households. Have you seen that number staying relatively steady as we could hopefully come out of this a little bit?
Yeah, I'm actually going to defer to Amy. We all wear a lot of hats, and Amy's day job is the lead for the supervisor of our data team. So she can probably give you the most precise answer on what we're seeing in terms of transmission. But we are, of course, the contact tracers are relieved. We were keeping up. It was challenging. We made a shift where we had the case investigations are more complex and require more training than the contact investigations. And so when we started to see a surge, we trained up all of our staff and all of our volunteers to be able to do case investigations rather than having some with the training to do that and others who had just the training available to do the contract investigations. So now we have a very nimble team. We have a large team of folks. We have incredible volunteers who have committed for 6 months, 20 hours a week, so we can have consistency. And we were keeping up. It was very challenging, but we're in a better position, and I can hear the levity in the voices of our leads that we're really in a better position and really pleased with what we're seeing in terms of the case rates. And Amy, if you want to answer the question on transmission.
Yeah, would you repeat the question? I'm sorry.
Yeah, no problem. Thank you. Was wondering if previously we said transmission was about 80% for small gatherings and household, at least when we were seeing the high case numbers. Are we still seeing about that proportion, or is something else? Are we seeing transmission somewhere else recently?
Yeah, no, I don't have the exact numbers. Our actually data team is meeting later on this afternoon to go over this week's data and what we're looking at and those epi reviews. But just in the conversations I've been having with the team over the week, those haven't changed. I can't give you the percentage number at the moment, but it's still the social settings and the home gatherings that we're seeing predominant for transmission.
Our next question is from Joe Tehan with KGMI. Joe's asking, is the vaccine being allocated to counties by population, infection rates, or some other formula?
Yeah, I can take that. some other formula. There's a multitude of things that the Department of Health is taking into account. They have estimations for each county's within phase 1A eligibility, obviously phase the 1B1 now. They're looking at number of providers, their capacity to store and administer. They're also taking into account each provider needs to order every week and project what they're going to administer in the following week. So they take that piece of information into account. So it's a multitude of data points that they're using to look across the state to figure out how much allocation goes not only to what county, but then to each provider in those counties.
Next question is from Ryan Harris with Como Radio. Ryan, go ahead.
Hi, thanks for that. And sorry to make you run down more numbers, but I think I might be having a little trouble with the dashboard. But you had mentioned right up off the top that some of these numbers were declining. Would you mind specifically the new case rate per 100,000 over the last 2 weeks, where that is now and where that's gone, and what other figures are declining?
I'd have to pull up our risk assessment dashboard, but what we're seeing over the last week or so is fewer number of cases per day, lower percent positivity among our testing site, and fewer demands for, not demands, but fewer need for testing. There's fewer people coming on average in the last week to our testing site. And so those are all indicators that are positive and going in the right direction. But again, it's only been it's been less than a week that we've started to see this. So I that's why I'm cautiously optimistic. Amy, do you have anything you want to add to that?
No, I would have to do the same thing of looking up the risk assessment dashboard at this point. I think everything was accurate.
This is Melissa Morin, and I do have the dashboard pulled up. It looks like we reached a peak of about 530 cases per 100,000 over a 14-day period. That was the period from January 1st to January 14th. I'm sorry, that was the period from January 3rd through the 16th. And since then, though the data is still preliminary, we are seeing the numbers trending down since then. So that looks like our most recent peak. Next question is from Robert Mittendorf with the Bellingham Herald. Robert, go ahead.
Hi, thanks again. This is kind of peeling off my colleague's question. If 80% of the transmission is being seen in small family gatherings and social settings, does that include in-person dining in restaurants, or is that separate? And do you have any stats regarding that?
That does not include. Actually, you know what? I will pause there for a second. For definitely, obviously, the home. For the social gathering pieces, I believe I'd have to double check with our epidemiologist, but I believe that the social gatherings are not at a public place. They're more of the private locations.
Okay. How could do you guys keep data on like how many cases are showing up? I realize in-person dining has been closed for a while, but it's closed. So I was wondering if there's any indication if it's the 20% in there, or like, do you think the restrictions might be relaxed anytime soon in that area? I realize you don't set those rules.
Yeah, that is hard to say. Among the 20%, so there's a certain percent that are unknown, the transmission source are unknown, but the remaining 20% of those that we do know are a variety of different places. So it could be workplace transmission. Amy, jump right in. It could be in a faith community, or it could be at a, like at the work release center, those kinds of things. So there's a variety of different settings, but none really rise to the level of concern that we saw in social gatherings and household. They're all just a small fraction of overall transmission.
Okay, great. Thank you. Thanks, Amy and Erica.
All right, I do not see any more questions in the chat, so I will do one last call for questions. That usually brings in a few more, so we will pause quickly here just to see if there are any last questions. And again, a reminder, these briefings are usually up. If you want to double check any of the specifics that we've shared just within an hour to a couple of hours up on the Whatcom County Government YouTube channel. And it looks like my threat of ending the questions truly has led to an end today. So with that, we will sign off. Thank you all for joining, and we will see you back here soon.
Thanks, everyone.